Ectopic pregnancy is one of the most common dangerous emergencies in our reproductive health. It occurs when a fertilized egg implants itself outside the uterus, most commonly in fallopian tubes. So it can lead to complications if not early diagnosed and treated. Remember, if the egg attaches itself in the fallopian tube, sometimes fallopian tubes might rupture, leading to severe bleeding and infection, and at some point it can also lead to death. For ectopic pregnancy to occur, there are some conditions that plays a major role in slowing down or blocking the movement of the egg down the fallopian tube. One of them being endometriosis. Another one can be growth in the fallopian tube, damage of fallopian tubes from sexually transmitted infection that has not yet been treated well. We can also have scarring tissue, adhesions, or inflammation from previous pelvic surgery. At some point, in rare occasions though, we can have this contraceptive method, intrauterine device, the IUCD. In rare occasions, pregnancy occurs there, but at some point, if it occurs, it increases chances of it being ectopic pregnancy. The symptoms might be similar to the typical pregnancy, but there are some additional symptoms kama abnormal vaginal bleeding, at some point kuna shoulder pain, dizziness, anasikia kufaint. If the fallopian tubes are already ruptured due to ectopic pregnancy, the mother might experience severe sudden abdominal pain, anaweza collapse, anaweza enda into shock. At some point ukimwangalia na pale, blood pressure yake itashuka, ukimwangalia pulses zake zitakuwa too rapid, and at some point she might act confused. When managing ectopic pregnancy, we usually give methotrexate medication if only your fallopian tubes are not yet ruptured. This usually stops the fertilized egg from growing and ends the pregnancy. But if the fallopian tube are already ruptured, we do surgical treatment.